whether you're going up or down to a 7-day. But again, this is new territory, rising above 10% for the first time since we've been in the pandemic. I want to spend a minute talking about underlying health conditions. When we've been reporting those that have passed away with COVID, we've been always saying that the majority of them have underlying health conditions. Feedback that we've received from local public health and from the medical community, perhaps because we included those words, those are the words that come off of the death certificates. And so perhaps people think that by saying that somehow we're trying to downplay the seriousness of this disease. There's certainly more known about this disease now than there was at the time, and there's more known about the tie between underlying conditions and who is at most risk. One thing for sure, we know from the death statistics that this continues to be particularly challenging for people with advanced age. And as it is here in North Dakota, as it is around the country, the majority of those people who have passed either with or from COVID in North Dakota have been over the age of 70. But again, when we take a look at populations, one of the good things about North Dakota is people live long lives here. We have over 15% of the state population, or almost 115,000 individuals that are over age 65. So that's a group that's at risk. But now when we've got this broader list of things that could lead to be considering a health condition which gives you a more risk of either serious illness or death from COVID, it includes things like cancer, like heart disease, like obesity, like chronic kidney disease, diabetes, asthma, and certainly smoking is also something that's been added to the list. So then we say, well, then how many North Dakotans have one or more of these underlying health conditions? Well, the sad news on that is that it's about 66% of the state of North Dakota has at least one of these conditions, and there are others included being like immunocompromised or people that might have recovered from cancer. So we don't want to give anyone a false sense of security surrounding their risk. So beginning tomorrow, when we're announcing the death certificates, we're removing
Life is full of bittersweet transitions. It's difficult to know how these changes will impact us over time.
But when it comes to the death certificates, there's another level of challenge because we do know that states are reporting deaths differently. And so I'm sure this will be debated long after the pandemic is gone, but state-by-state comparisons can be challenging based on differences that the states are using in their coroner's office and others for how they're reporting coronavirus either with or from COVID. When we go to active cases across the state, I mean, again, this is the thing where we talk about our numbers headed in the wrong direction. We now